Hello, my name is Iris Barahona. My presentation will be on prescription drug abuse. The prescription drugs are also known as psychoactive substances, and they are categorized into 5 different levels. But for the purpose of this presentation, I would like to focus on Schedule II drugs. The Schedule II drugs are prescribed substances that are highly addictive if taken for a long period of time. Some examples of Schedule II drugs are Vicodin, cocaine, methamphetamines, methadone, hydromorphine, Oxycontin, Adderall, and Ritalin. This is why psychoactive drugs, known as Schedule IIs, are a big issue in today's society due to the misuse or overuse of the prescribed medications. Prescription drug abuse is a serious problem in today's society. More people died from drug overdoses in 2014 than in any other year on record. Deaths from drug overdose are up among both men and women, all races, and adults nearly all races, according to the CDC. A brief background. So originally, prescription drugs are controlled, were intended to be controlled by a prescription that was given by a physician. If the drug that was prescribed was habit forming, not safe for medication, to be self-administered, and intended to treat ailments that require supervision of a health professional. So what are psychoactive substances used for? The drugs are prescribed by a physician to treat medical conditions such as depression, anxiety, drug addiction, severe pain, and attention deficit disorders. Psychoactive drugs, consequently, are subcategorized into 4 different groups, which are as follows. They're either hallucinogens, stimulants, depressants, or opiates. For the purpose of this presentation, I'll go ahead and focus on stimulants, depressants, and opiates. So what are stimulants are prescribed for? So the stimulants are prescribed for attention deficit disorders. The purpose for the prescription stimulant is to produce a calming effect in children and teens or adults. Some stimulants commonly used are amphetamines, Adderall, and Concerta. On the other hand, there's negative effect abuse of stimulants. When an individual commonly uses stimulants to suppress appetite, increase wakefulness, and increase focus and attention, to help him or her study or boost grades in school. What are depressants? That's the second category of the psychoactive substances. These are also known as downers. Physicians prescribe depressants to treat medical conditions such as anxiety, sleeping disorders, panic attacks. Some depressants normally used are Zyprexa, Seroquel, Xanax, and Clonazepam or Librium. The negative abuse of depressants are that when an individual uses depressants for a long period of time, they develop physical dependency, and that makes it really hard for the individual to quit the depressant. And also, after taking the medication for a long period of time, there's risk of developing suicidal or homicidal tendencies. Lastly, what are opiates? These are prescription painkillers. Opiates include heroin, morphine, codeine, Oxycontin, Dilantin, methadone, and others. the negative abuses of opiates, according to the CDC, are Oxycontin and methadone and hydrocodone are often mostly abused. Population more at risk of suffering for prescription drugs are low income population, Medicaid population, people who doctor shop, go from doctor to doctor, teens who have easy access to prescription drugs at home, people with substance abuse. Tendently, overdose rates are higher among people ages 25 to 54. So Schedule 2 drugs tend to have the same withdrawal symptoms as illicit drugs, such as delirium, sexual problems, convulsions, agitations, hallucinations, and also individuals have a tolerance that could be developed rather quickly. So in severe cases, also death may occur for a prescription drug overuse. So in 2009, there were nearly 4 billion drug-related emergencies, and that were attributed to adverse reaction to pharmaceuticals, drugs, and also they were attributed to the misuse and abuse of prescription drugs. Thank you for watching. These are my references.